going here. Let's see. All right, how's that? Everyone seeing it? Okay.
That's great.
Good, good. So we're going to talk about finding your balance and sort of different ways to find balance in the role of the caregiver, specifically focusing on mindfulness and how we can apply concepts and techniques from mindfulness, specifically in the role as a family caregiver. So I'm going to talk a little bit just about the illness experience. What are some common features of either being a person with the illness that are also very similar for people who are caregivers? Talk about or introduce this concept of post-traumatic growth. What do we mean by that? And how can mindfulness be a practice that might help to facilitate that sort of growth? I'll talk to you about mindfulness-based interventions, so what these are, how they're usually structured. And then taking some techniques from mindfulness-based interventions to help balance both your nervous system and balance yourself and your role as a caregiver. And talk about this idea of the tripod of support and some different metaphors that help you feel that sense of stability. And then a number of resources that you can either sort of take a screenshot of, or I'll share these slides afterwards as well. All right, so the illness experience. There's some commonalities that run across different types of illnesses. So I work mostly with people who have had cancer and their family members, but there's commonalities no matter what type of chronic illness we're dealing with, whether it's heart disease or dementia or many other things. So often there's a sense of loss of control, right? So we realize that the future is unknown, there's uncertainty, there may be a life threat. One is called to look more closely at the limited time span or our life threat, which is always there. We all know there's one way in, one way out, but we tend to sort of not think about it until something like this happens. We get a diagnosis and we realize that our time actually is limited. And so how do we want to use that time? And that can trigger an existential sort of crisis. There's, as I said, this loss of uncertainty or predictability around the course of disease, what the future might look like. Do we have to change plans, retirement plans or vacation, or even just where we're living and the routine that we follow day to day? So there's lots of emotions that arise during this whole process. There's grief and loss for the present, but also maybe anticipating that in the future. There's a fear of what the future might hold. And there can be all kinds of feelings of anger, or sadness, depression, shame, or guilt, depending on the type of disease and one's role in bringing it on. And so there's many physical symptoms that people often have to encounter. And this is more the case for people going through treatment or that kind of thing, the pain, fatigue, difficulty sleeping, brain fog. If you're living with someone or a caregiver for someone going through treatment, it can be really hard to see them go through these types of experiences and wondering how to help. And so even, for example, if it's a disease like cancer where there's treatment, it's finished, maybe the prognosis is good, but there's always a fear of the disease progressing or recurring in the future. So every ache and pain can be really causing a lot of anxiety around what does that mean? And of course, the issue of caregiver burden. So we know that caregivers often experience just as much anxiety, depression, fear, sadness as people with the illness, and sometimes even more. But caregivers often don't feel like they can, ask for help or say anything about what they're going through and their own difficulties because the focus is always so much on the patient. But indeed, the caregiver needs support as well because you're going through all of this together. Well, how can anything be good about this? I'm painting a pretty bleak picture. So the flip side of that is something that we in psychology call post-traumatic growth. And really all this is positive psychological change that's a result of a difficult or traumatic experience. It's a result of the struggle with these highly challenging life circumstances. So a difficult experience like a chronic or progressive illness can be the trigger or the catalyst to look at life maybe in a different way. So we break these down into 5 different areas like personal strength. So people can recognize their own resilience and become more self-reliant and confident and develop a way to live more meaningfully and more authentically. They can see new possibilities, perhaps things they hadn't considered before. An example is maybe being open to learning mindfulness. You might have thought it was kind of weird, new agey, but well, actually maybe yoga or mindfulness or some of these other things are an avenue forward. It can improve relationships when people talk and share their feelings and support one another through difficult times. It can lead to spiritual growth. And by that, we define spirituality or think about it as connection with something larger than oneself. So, connection with the universe, with one's community. It could be with your religious faith, but it does not have to be tied to religion. It's about feeling part of something larger than yourself and appreciation for life. Perhaps we can appreciate the small things and feel a sense of gratitude or helping other people. Look at our priorities, what's meaningful for us in life. So these are all possibilities that we often see when people go through difficult and challenging circumstances. But you may be thinking, well, that sounds great, but how do I get there? Right? And we know that sometimes there's this, we call it the prison of positivity, this pressure to, oh, just think positive, put on a happy face, everything's going to be fine, right? Don't talk about the difficult parts. And that's not at all what I'm talking about here. It's not pretending that this isn't difficult or that the emotions aren't tough and that the day-to-day isn't difficult. It's about acknowledging that and facing it, the truth of it, and using it as a life experience and a catalyst for authentic growth. And that often we see happening through things like learning mindfulness practice. So what is mindfulness anyway? There's lots of myths and misconceptions out there. It's become a very popular buzzword too. So what is it really? So for example, if you listen to Time magazine, you might think, you'll become this blissful, calm, peaceful, young, beautiful, blonde woman. Well, that's a bit of a myth, isn't it? So what is it really? We define it as paying attention on purpose in the present moment with an open and accepting attitude. Okay, so we can unpack that in a minute. But mindfulness is a way of being in the world. So it's two things. It's a way of being. You can be more present, be more mindful no matter what you're doing. You can mindfully wash the dishes, right? It doesn't take extra time to do things more mindfully in your life. But it's also a practice that allows us to build the capacity or the skill for being more mindful, because it is like a skill. It's like learning tennis or piano. We have to practice it. So these pictures illustrate kind of the distinctions here. So here's somebody whose mind is full, but it's not full of what's happening in the present moment. It's full of worries and concerns and memories, right? Contrast that to someone or something who's mindful in the moment. The dog isn't thinking about the past or the future, right? The dog's enjoying the moment. Maybe we need to be a bit more like our pets sometimes. And here's an illustration of the practice of mindfulness meditation. So setting aside time to formally sit and train our minds in the capacity to pay attention. So there's an interesting observation that our mind is really busy. And so we have anywhere from 50 to 70,000 individual little thoughts every day. It's a lot of thoughts, right? Where are they going? What are they about? Well, if you ask people, what are you doing and what are you thinking about throughout the day? It turns out that about half the time, people are not in the present moment. And I often ask audiences this question, and they usually say, how much time do I pay attention? Oh, hardly at all, 10%, 20%. Data shows about half the time people are paying attention to what they're doing. But the interesting thing is that when they're paying attention, no matter what they're doing, washing the dishes, caregiving, if they're paying attention to it, they report being happier than when their mind is wandering. Okay, so why would you feel happier or better when you're paying attention to mundane things? Well, where's your mind going otherwise? Often to the past, like this fellow. He's thinking, oh, if only this or if only that, or why me? Or he's having regrets and he's wishing shoulda, coulda, woulda, done things differently or said things otherwise. And so you can't change the past. So it's frustrating and you get depressed and you have regrets, you might get angry. And so that doesn't feel very good. Or you're like this person where her mind is racing off into the future, right? She's thinking about what's going to happen with my job and my health and all the money and the pressure and all the things I have to do. And so you're getting stressed and anxious because you're worrying about all that stuff that may or may not be an issue in the future. So it makes sense then, if you could be in the present moment, that a lot of that falls away. So really the core feature of mindfulness is just being in the here and now, just paying attention to what's actually happening. And we do that in a certain way. So we can break mindfulness down into three components. The first component is the why of it. We call it intention. So why would we want to try and do this in the first place, right? So we say it's on purpose. What's the purpose? It can be many-fold and it can change over time or even day to day for people. It may be to just be more awake and aware in your life, to be present with the people around you, maybe to foster a sense of connection with something larger than yourself, maybe just to sleep better or get through a painful experience. So there's a why you practice, there's your intention that you set. There's also what you do. So the core of the practice is training your attention. So that's the formal practice of sitting down, focusing on one object, often say the breath or the body. And when your mind wanders, you bring it back. And through that process, it's just like practicing your scales for piano or doing your serve for tennis. You get better at mindfulness. But it's also important how we do it. That's our attitude. So it needs to be kind and accepting and open and non-judgmental. Because it's very easy when you start to pay attention to what your mind's doing to be like, oh God, my mind's a mess. I'm like worrying all the time. I can't control it. That's totally normal. And so we need to be kind and accepting and non-judgmental. And that allows us to sustain the practice and the training we need to do to become more mindful. So here's an example of some attitudes around mindfulness that I've already mentioned some. So non-judging of ourselves, it being a little, becoming aware of the fact that we're always like, oh, it's good, it's bad, I don't like it, I like it. And just letting go of a little bit of that and allowing things to just be as they are. Patience. So it's a bit of a fast food culture we have. It's like, I want to relax, I want to feel better, like now, right? And that's counterproductive. So recognizing that learning these kinds of practices takes time. You know, just like if you're sitting at a traffic light, the red light's going to be long, just as long if you're miserable or if you're happy. And that's your choice. You can spend that time being miserable, you can spend that time being happy. The red light doesn't care, right? So practicing patience can help completely transform your experience. Acceptance. This is a tough one. Acceptance does not mean giving up or giving in. It means seeing things clearly as they are. You don't have to like it. You don't have to like that your loved one is going through a difficult time and that you're in this position of being a caregiver. But if it's true, then it's true. If that's where you are, then that's where you are. So accepting it, feeling it, recognizing it is your starting point. And it's only when we can say, yeah, I feel rotten, I'm having a hard time, that we're able to say, okay, what can I do to help change that? And so we let go, though, of trying to control things we can't control. So making that distinction. Okay, what can I do and what can't I change? And let go of those things that you know you're never going to be able to control. And non-striving for specific outcomes. So learning actually to recognize that the only certainty in life is change and ride the waves of change. And within that, doing the things that you are able to do. Trusting your own intuition, trusting the process. And this thing called beginner's mind is seeing the world as if for the very first time, like a little child. You know, the little kids, they're drive the parents crazy because, you know, they can't walk down the sidewalk without stopping 5 times to look at the flower and pet the dog. And, you know, they're really in the moment, right? And that beginner's mind can bring joy back to your life. And so the opposite of this, people often say, I don't know, you know, that's a tall order. I don't know if I want to do all this. Say, well, you can go the opposite way. And what would that look like? You could be judgmental, impatient, rejecting, grasping, striving, suspicious, and know-it-all. Okay, does that sound like fun? Maybe you know someone like that. It's basically a recipe for stress and unhappiness, right? So keeping these attitudes in mind is very helpful. And as I said, there's many myths about mindfulness. So it's not just relaxation. It's not always relaxing. It's about paying attention to the full spectrum of your experience. So it's not like letting go of all tension, although sometimes it is relaxing. It's not a hypnosis or something that someone does to you to achieve a certain state. It's not a religious practice or a form of prayer, although it can be incorporated into any spiritual practice or religious practice you may have. It's very secular. It's not clearing your mind of all thoughts. You know, like the woman on the magazine cover, it looks like she's all blissful and has no thoughts. It's accepting your thoughts as they come and go and letting them go, not being attached to them. It's not always peaceful and calm, although often it is. That's not the objective. So if you want to learn more about mindfulness, I recommend this book. called Full Catastrophe Living, Using the Wisdom of Your Body and Mind to Face Stress, Pain, and Illness, written by a wonderful guy named John Kabat-Zinn almost 50 years ago now. Well, I guess 40 years ago. He developed a program called Mindfulness-Based Stress Reduction in the 1970s. And what it is a structured 8-week group program that trains people systematically through meditation practice, through gentle movement, on how to be more mindful in your life, to face all the difficulties. You can get MSR programs almost anywhere now. They're very, very popular. And there's been a ton of research, scientific research, showing that these programs are effective for a very wide range of physical conditions and psychological conditions and symptoms. So this is an interesting graph, at least I think it's interesting, that shows the growth in mindfulness research over the years. And what this shows is journal articles, so in the scientific journals, that have the word mindfulness in the title of the article. And you can see across the bottom, these are the years. So it starts in 1980 and makes its way all the way up until 2024. And so you can see right here, around 2000, that just happens to be the year that my group published our very first paper on mindfulness for people who have cancer. So we were the early part of the tail, but it just has increased exponentially since the turn of the century, where there's over 1,000 academic scientific papers evaluating these kind of training programs. So all this to say is that there's a very good, strong evidence base that if you participate in one of these 8-week programs, there's likely to be some kind of benefit for most people. So let's put it into practice right now. Let's do a little bit of a breathing exercise where we're just going to pay attention. We're going to be mindful, right? So what's mindfulness? Paying attention on purpose in the present moment with an open and accepting attitude. So we're going to be mindful of our breath. So I'll invite you to notice your posture. If you're all kind of slumped over, let's maybe sit up so there's room for our breath in your torso, through your chest. Take one hand and put it here on your upper chest. Take your other hand and place it over your belly. Notice any judgments about that, let it go. And now we're going to just pay attention to the breath. So I call it being a breath detective. So if you're comfortable, let your eyes close or just soften your gaze. And don't try and change your breath, just notice it. So note silently to yourself in. As you breathe in and feel the movement through your hands, and note to yourself out as you breathe out. And with each breath, begin to notice how long the in-breath is, how long the out-breath is. Is there a pause between the in and out, or the out and in? Or does the breath just flow smoothly? Is there any jerkiness? And which hand is moving, or maybe both are, but how much does each hand move as you breathe? Are you holding muscles tight in your belly, or your shoulders, or your face? And if you want, you can just soften all those muscles and let your shoulders drop down if you want. Just continue to note in and out of the breath. You may notice other things about your body, like your stomach digesting your lunch, or your heart beating, or tension through various parts of the face, or shoulders, or back, or even through the legs. So we'll continue just for a couple more breaths. Again, noticing everything you can. Okay, and again, without purposefully changing the breath, just noticing any changes that happen of their own accord. All right, now lowering your hands, opening your eyes if they were closed. I could just sit and do that all day. Um, all right, so do you want to share in the chat any observations? So what did people notice when you were doing that? For example, was there more movement in the upper hand or the lower hand? Was the breath short or was it long? Was it even? You can just pop a few things in the chat there. I'll give you a second. How did it feel to do that exercise? Did you notice any changes with your breath? I'm not seeing anybody. There we go. More on the chest, less on the belly. Someone says it felt great, Cecilia. Oh, here we go. They're coming through. I felt both hands, says Marnie, more in the lower hand as she continued to breathe. Felt good, once in a rhythm, relaxing, made her sleepy, relaxing. Too much go, go, go. Exhale got longer and longer, shoulders relaxed. Breath was shallow. Felt so nice. Marjan noticed some thoughts rushing through. Yeah, that's pretty normal too. I should have mentioned that. Kept thinking about what I was missing. Yeah, there's nothing to do, nowhere to go. Someone liked the image of the waves. All right. So that's a good representative sort of feedback on this kind of exercise. And often what people notice is things about their body they weren't aware of. There might have been tightness in the chest or the belly. Maybe we were breathing a bit more shallowly in the upper chest. We don't need to be doing big, deep belly breaths all the time, but an even breath, so where there's movement in kind of both hands, does tend to promote more balance and, as some people said, a feeling of relaxation. And what's super interesting that one person at least noticed is that even if you're not trying to change your breath, just by paying attention to it, it changes and it becomes more balanced and more even in the body because that's what your nervous system and your body naturally craves is that sense of balance in the breath. And we get in the way sometimes, right? Our thoughts often get in the way. So that's a very simple mindfulness exercise. Let's just continue on here. So I'm going to tell you a bit more about the mindfulness-based interventions more generally that are adaptations of that MBSR program. So they're typically 8-week interventions, 2-hour meetings, a couple of instructors. They started in person, but many groups are now offered online. And it's a typical, a standard sort of format where there's some group sharing and some discussion, and then there's practice. We do mindful yoga or mindful movement, followed by different practices of meditation. I'll tell you about in a minute. There's usually a booklet, includes a reading list. Often or always really daily meditation practice at home is encouraged, anywhere from 10 minutes to 30 minutes to 45 minutes every day. And we provide guided meditations for people to use. They keep track of the time they practice. We discuss every week how the home practice went. And there's a longer retreat near the end of the program to consolidate all the practice. So there's many different components. The overarching theme is mindfulness, about how people can become more mindful in their daily life. And we do teach specifically how to use different breathing styles to promote relaxation. The movement, again, the gentle yoga practice, it's really more about mindful movement. It's not like a performance or a competition or anything like that. There's discussion around how the mind and body are connected. We use some visualization and imagery that I'm going to show you at the end. We talk a bit about stories we tell ourselves and how thoughts can get in our way when it's time to cope. There's an element of personal empowerment, so giving back a sense of control of things people can do in this difficult situations. And of course, there's social support because they're often done in groups. So this just shows you some of the mindfulness practices. Let's get to the pictures. There's people doing a body scan. They're not napping. They're actually taking their attention from their toes up to their feet. You can find guided body scan meditations in many places. I'll show you some. These are people sitting, doing sitting meditation, so you don't have to sit like a pretzel on the floor. Most people do it in a chair. You can meditate while you're walking. This is some of the imagery we use of the mountains and the lakes, and we practice loving kindness to cultivate self-compassion and kindness towards others as well. So I mentioned the yoga, and this is really important, especially for people going through illness experiences, to reconnect with their body as it may be in the moment. There's many changes that come around. People may feel alienated or frustrated or disconnected from their body through the course of illness. And so this is a way to refriend, to reconnect, to familiarize, to listen to what the body is telling us, because it's always telling us something, but often we're not listening to it. So I promise only one slide of research results. No graphs, although I love graphs. Okay, so what have we found in our research program? And again, we are not the only people doing this. There are hundreds, thousands of studies. But typically they find similar kinds of things in populations of people going through medical conditions and treatments. So decrease in stress, improvements in mood, less anger, less anxiety, less feelings of depression and sadness. People sleep better, they have less fatigue, they ruminate less about the past, worry less about the future. And we have done specific research looking at partners who are invited to come with the people who have cancer in our programs, and done the same questionnaires, and the partners benefit just as much, in some cases more than the patients themselves. So we do see enhancement in what I mentioned at the beginning, this sense of post-traumatic growth, spirituality, overall being more mindful, being more aware, better quality of life. And we poke and prod people and look at blood samples for immune function and saliva samples for stress hormones, and all of those things improve as well. So we know that this practice gets under the skin and in the body. Improvements in blood pressure. We even see at the level of the DNA that there's an alteration in cell aging. So this kind of practice is not in your head, it's in your head, it's in your body, it's everywhere. All right, so let's focus in a bit on finding balance. So let's talk about balance in the nervous system. And this is going to take us right back to the breath again, which is such a key component in how we feel. So if we think about our nervous system, we can break it into two big branches. There's the voluntary nervous system. So things we do on purpose, like I'm going to raise my arm. So my arm goes up. I'm doing that voluntarily. But there's also a ton of things that happen in our nervous system that are automatic or autonomic, they're called. They just happen whether we think about it or not. And that's a good thing. We don't have to tell our heart to beat. We don't have to tell our colon to digest our food or our glands to secrete the hormones that we need. That just happens automatically. So that's all happening outside of our conscious awareness. Now, within that autonomic nervous system, so now we're just looking at the autonomic stuff that happens automatically, we also have two branches, and these are kind of balanced with one another. They're kind of in counterpoise. So one is called sympathetic, and that's your what we would call arousal or fight or flight or energizing arm of that sympathetic nervous system. So, everyone knows this, that you're driving along, a dog runs in front of your car. Oh my gosh, you jump, your palms tingle, you get sweaty, your heart starts racing, your blood pressure goes up. That's the fight or flight response. That's the sympathetic nervous system doing that. So it's got different hormones like adrenaline. It's got parts of your nervous system that trigger very quickly. And that's all in well when, it's a dog in front of the car, the dog passes, everything's safe, you calm down a little bit. But when we have these consistent psychological stressors, argument with your teenagers, difficulty at work, coping with a chronic illness, it's just one thing after another triggering that sympathetic nervous system. So you can be constantly in this state of jacked up arousal, right? Where you're just on the edge. So the other side that balances that out, that's called the parasympathetic. So that's the relaxation response. If this is the stress response, this is the relaxation response. And so if we can activate that relaxation response, it automatically takes down the stress response and we can get to a more balanced place. So that's what we want our nervous system to feel like most of the time, right? Is that you might get short periods of the stress response, but then it goes back down and we can feel more balanced. And then when it's time to sleep, we have more of the relaxation response. Okay, so here's the cool part. So that's part of the autonomic nervous system. It happens automatically, right? But there is one function of the autonomic nervous system. Well, there may be more, but there's one key function that we can also control voluntarily. What is it? obviously, I think, the breath, right? And the cool thing is that the two parts of the breath are each connected to the two parts of the autonomic nervous system. So we think about our sympathetic, right? Our fight or flight, our arousal level, that's associated with the inhale. So you think about when you're stressed, or again, the dog running in front of a car, you're like, you're taking these quick, deep in breaths, or shallow in breaths even, but we're emphasizing the in breath. And that's associated with the stress response. When we want to relax, we might have a big sigh like, the exhalation stimulates the relaxation response. Okay? So knowing this, that the inhalation is more arousing or energizing, the exhalation is more relaxing, we can adjust our breath on purpose to balance our nervous systems and the way that we feel. It's very cool. So I'm going to show you just some very simple breathing exercises, how we can do that. This is one of my favorites. So this is balanced. So anything where we breathe in the same amount that we breathe out is called a balanced breath. And here we add in an imagery. So we're just imagining a wave. So we allow our breaths to just let your belly soften, just let your breath kind of go. You might want to close your eyes or even look at the diagram. And as you breathe in, you're going to count up 1, 2, 3, 4, and then ride the crest of the wave and then go down 4, 3, 2, 1. 1, 2, 3, 4, and then 4, 3, 2, 1. So find your own pace that's comfortable. And just practice it a couple times. So it takes a bit of practice to just get the right pace and allow your breath to slow down a bit. So we want it to be nice and balanced. You can imagine that wave. Okay, open your eyes if they're closed. If we want, you could share in the chat. Let's have a couple of chats around how that felt. Oh, there's something about telomeres. I can answer that question later. Oh yeah, I'll answer that question. So how was that balancing breath? What did it feel like for folks? Was it easy, difficult? Did it seem to sort of balance your nervous system a little bit? I love that one. Someone says Shelley. Okay, we won't take too long for feedback, but you can put it in there. In and 6. Oh, I'm not sure what Susanna's saying there. Someone else says, great. Breathe in 4, exhale for 8. Oh, so someone's ahead of us. The 4, inhale 4, exhale 8 is called a 2-to-1 breath, and it is more relaxing because it emphasizes the exhalation. So I'll get to one of those in a second too. Let's keep going. So this is a balanced breath. I don't know if I'll practice the next one because I'm running a bit out of time. This is another balanced breath. So it's called square breathing. And what we do is add a pause, both at the top and the bottom of the breath. So the idea is that you would breathe in for 4, you hold with your lungs mostly full, pause for however long, it could be 2, and then you're making a rectangle, right? A little bit of a pause, exhale, say for 4, and then pause at the bottom with your lungs mostly closed, and then making a square like that. Maybe practice it a little bit. I hate to shortchange the practice. Even if you just do it a few times, you may notice that the pause at the top of the breath feels different than the pause at the bottom of the breath. So holding with lungs full versus holding with lungs empty. And so the reason for that is because, again, it's tied into different parts of the nervous system. So when we pause with our lungs full, that's like emphasizing the inhalation, and it actually accelerates your heart rate a little bit. When we pause with the lungs empty, that's like a continuation of the out breath. And for many people, once you get the rhythm, that's very peaceful and calming. And so this idea of adding in the pauses in this balanced way leads to the next two, which are called triangle breaths. So now these ones are not balanced. They're aiming for a certain outcome. So this relaxing triangle breath takes that same idea, of the pause, but just leaves it in after the out breath. So you breathe in for 4, out for 4, and then you pause at the bottom. So it's like 2/3 of the triangle are emphasizing the exhalation and the pause. So you're inhaling, you can try it if you want, exhaling, and then the pause. I didn't get carried away with that one because I like it so much. It takes a bit of practice sometimes to get the timing right, and so it doesn't feel like a forceful breath. Um, oh, so I just saw a chat. Drawing the shape in the air with my finger while I breathe helped me stay at the same pace. Yeah, that's actually a really good idea, is like bringing the body into it as well, making it more concrete, um, whichever pattern of breathing you're following. So this is the relaxing triangle breath. I'd be curious if anyone wants to know if it actually was relaxing. And the last one is the opposite. It's the upside down triangle, which is the invigorating triangle. It's the same rationale. So this time we're emphasizing the in breath. So we breathe out and then we breathe in and then we pause with the lungs full. So 2/3 of the triangle are about the in breath. And that accelerates the heart rate and increases your level of energy. So I use this one all the time, usually when I'm falling asleep in the car driving on the highway, because I live in Canmore and I'm often driving back and forth. So this one, it actually, again, increases your level of energy and kind of wakes you up if, you're feeling tired and you kind of need to get energized. All right, I'm going to carry on to get through this last section. So that was balance within your body, inside your body, and your nervous system, the way you can use breathing to find that kind of balance. What about role balance? So there's the role as the caregiver, but there's also the role of taking care of yourself, of self-care. How do we find that ideal balance? And this is simplifying somewhat, but it's a good concept to think about, right? Because if we get out of balance, just like within our body, if we get out of balance outside our body, we're not very useful, we're not very healthy, we're not very productive, and we're not a very good caregiver. So how do we find that balance? So one concept that's helpful, I think, is this tripod of support, or this idea of 3 points of contact. So if you're ever doing a sport like climbing, you always have to have 3 points of contact, both hands and a foot or both feet and a hand. And we saw that if anyone was at Mike Lang's Caregivers presentation with the paddleboarding, he talked a lot about this 3 points of contact, using the paddle as 1 point of contact. So when we think about this in self-care, what are the 3 points of contact that you have at any given time? And they may change over time, but having the sort of that tripod of support around you is very beneficial. So these are some examples that might be your personal contacts. So time in nature, spending time with friends or with pets, doing hobbies, things you like, meditation, yoga, like I just talked about. And I've got the dots for you guys to add in anything in the chats that you find to be supportive for your own self-care. And I didn't put in there, well, I put hobbies, but like creative outlets like journaling or painting, that kind of thing. So feel free to pop anything in there. Dancing, music making. Oh, yeah. Music is such a good form of self-care and also a way to communicate. Yeah. Tarot cards, cool. Yoga, art, writing, lots of good ideas. Yeah. Singing while driving. Oh, I love it. I could just see her belting out. All right, well, think about that. And then we can also think about caregiving supports. What are our 3 points of contact as a caregiver? So self-care is one thing, but we also need supports for our caregiving. So are there professionals who support you? Is it spending quality time with the person you're caring for? So not just doing the practical activities of daily living, but actually enjoying time with one another, getting support from other family members. So what are the 3 points of contact in your caregiving role? Working on a puzzle, that's another good one. I like doing the Wordles and stuff on the New York Times puzzles. foster relationships. It's so important to have relationships, right? So family support. You can't be alone as a caregiver. I mean, that's why groups like this are so helpful as well. Yeah. Okay, let's continue on, but feel free to keep putting things in the chat. So what about some imagery we can use that's supportive of our points of balance, of feeling rooted? The mountain is a great image. And if I have a few minutes, I might take a couple of minutes and do just a brief mountain meditation with you guys. And so what we try and do in these meditations is use the image to embody qualities of the mountain, for example, that are beneficial to us as a caregiver or in our roles in life. So thinking about how, can you sit like a mountain and feel strong and stable and grounded like the mountain? Or another one we often use is the lake. And can we incorporate the qualities of feeling calm and peaceful and still and deep like the lake? So using those kind of images helps to enhance those qualities in ourselves. It is Rundle Mountain. Yeah. I live in Canmore. I'm on the other side of the mountain. Let me see what's left. Okay, just some self-compassion. Let's do just a couple of minutes of mountain. So just again, imagine that you're a mountain. Okay, you could be Rundle there. It could be a different mountain that you know or one you could just imagine. So you can look at the photo or just close your eyes. And as you breathe in, just sort of feel your head rising like the lofty mountain peak, and your shoulders are like the sloping sides, and your arms. And your legs and buttocks, they're like the stable base of the mountain. And you'll notice that up here at the peak of the mountain where your head is, it's clear and fresh, and the view is endless. Everything so little down below. You recognize time is a little more stretched out. The mountain thinks in geological time. So it changes your perspective. The little things don't seem as important. You can feel stable and rooted, grounded like the mountain. So with each breath, just incorporating those mountain qualities in your own body, in your own mind. Just breathing in the crisp, cool mountain air. And so just opening your eyes, that's just an example. And there's guided meditations of mountains and lakes that you can use to help really bring those qualities into your own body, your own experience. And I wanted to finish with just an emphasis on self-compassion, because so often, people have lots of compassion and caring for others around them and, the person you may be caregiving for. But what about ourselves? Sometimes we're hardest on ourselves. So we think about self-kindness as opposed to self-judgment. So being kind and understanding towards ourselves, especially when we stumble, when we have difficulties, when we feel inadequate. This inner support allows you to feel safe, and it puts you in a better frame of mind to cope with the difficulties. Self-compassion also helps us to recognize that we're not alone in our suffering. It helps us feel a sense of calm and humanity rather than feeling isolated. Our suffering is human. Everybody suffers and everyone wants to be happy. It connects us to others. And then this idea of mindfulness allows us to see our suffering without suppressing it or rejecting it or wallowing in it or exaggerating it. So we can turn towards our own pain with acceptance of the present moment and this kindness, this compassion. It prevents us from becoming over-identified with these difficult thoughts and feelings, and again, getting stuck there. And we won't always get swept away. So the mindfulness is one of the elements of self-compassion. So I'm just going to summarize here, and then we'll have about 10 minutes for Q&A. So we think of mindfulness as present moment, non-judgmental awareness with acceptance and kindness and compassion. It's a way of being in the world that we can cultivate through the practice of mindfulness, and many different practices can help us do that. Mindfulness-based interventions like MBSR are structured programs that train people in mindfulness and help decrease a range of symptoms. And we know that mindfulness in the moment can help people cope with everyday stressors, balance the nervous system. And this balance for caregivers can be achieved through the tripod of support and applying self-compassion. So the next couple of slides are lots of resources. So you can start today, this very minute, using those mini breathing exercises I showed you, right? The wave, the square. You can do those anywhere, anytime. You don't have to close your eyes. There's a number of resources. There's many, many, many mindfulness apps. This is some of the freer ones. And all these websites here have guided meditations, like the ones I talked about, body scans, sitting meditations. You can find them on those websites. And then this is just contact info for me. And also our own videos are on this Action Center website. So we have a whole series of yoga videos, guided mindfulness, audio tracks, and also we have a whole series of Tai Chi and Qigong practice videos there that are free for anyone to use. And that is everything. So I'm going to take these down. We'll try to take these down. There we go. And yeah, we can have a discussion or Q&A or whatever.
Thank you so much, Dr. Linda. I have written down some of the questions that came up if you'd like me to read them.
Sure.
So someone asked in regards to like the breathing techniques, how often should they do it and when is the best time during the day to do it?
Anytime, as often as you like. So if we're talking about, just there's many different breathing techniques. So you can just count the breath or pay attention to the breath like we did in the first exercise. Anytime you do that is going to help balance out the way you feel, the wave. I encourage people to use them anytime like they are feeling stressed out, if they're, stuck in traffic, if they're waiting in line, you're waiting for a doctor's appointment, you have to get a blood draw, you're at the dentist, you're, frustrated with your teenagers, you want to lash out at your partner, really like anytime. You can't overdo it. Yeah. Yeah. So that's what I would say is like anytime you think to do it, do it.
I think even just starting off, even if once a day, anytime you find it, it's a good way to at
Yeah.
least start practicing and
And you don't have
incorporating
to
it.
do it forever. Like you can just, spend like 30 seconds or a minute just paying attention to your breathing. I like to do it, like to use cues in your life as, a cue to do it. Like, so every time you're at a red light or like every time a text message comes in, take 2 breaths before you look at it, things like that, right? So tie it to cues that are already happening in your life.
That's a really good, I didn't even think about it like that before. So that's actually a really good way to do it.
Yeah, yeah. Someone,
Someone
I do
else
see a
said,
question. Oh, sorry. I saw I'm inhaling through the nose, but on the exhale, should I be exhaling through the mouth? It doesn't really matter. Sometimes people say inhale through the nose, exhale through the mouth. It's actually technically better to be inhaling and exhaling through the nose, just physiologically. It controls the flow of air better, but it doesn't matter if you want to exhale through the mouth, that's fine too.
learning something new. Um, Someone said, what, I think you mentioned you would kind of go over this at the Q&A, but what does telomere length mean?
Yeah, somebody put in an answer. It was probably fine. So what I'll just tell you, so telomeres are the caps on the ends of the DNA within your chromosomes. And typically when people age, like every time the cell divides, they're like the little tips on your shoelaces. So they get shorter and shorter. And if they get too short, then it can damage the DNA. And shortened telomere length is associated with increased risk for a number of different diseases. We also know that people who are exposed to chronic stress have shorter telomeres for their age than they should, or compared to other people. Um, and so our study we did back in 2014, I think we published it, was the first time anyone had looked to see if a short-term meditation, mindfulness intervention would have any impact on telomeres. And what we found was that we compared women with breast cancer who had done the program versus some who were waiting, and the telomere length in the people waiting got shorter, but the telomeres in the people who did the mindfulness program stayed the same. So they weren't shortening as quickly. Yeah. And so we don't know if that would last for a long time. We don't know if it would be associated with any clinical or disease related outcomes. But it was fascinating because it just showed that it had an impact.
Wow,
Yeah, it's cool.
that's really cool. Um, and then we have something in the chat. Someone is asking about the 3 points of contact. So can you kind of explain a little bit more about what that means? Does that mean, 3 different
Yeah.
points for support, or?
Well, the idea is that you have the most stable balance when you have at least 3 points of contact that you can turn to. It doesn't mean all at the same time necessarily, right? But if you think about, on the paddleboard or the climber, right? If they let go and only have 2 points of contact, they're more likely to fail, right? So it's the same idea of having the resources, at least three, that you can turn to as a point of support just to help keep that balance within the self-care and the care for others.
I think
I hope that answers the question a bit.
I saw a hand up.
Oh, someone's got a tree metaphor. I like that. Susanna says, I always identify with the amazing strength and story of the trees, because I was talking about the mountains, right? Each branch is a new story. The trunk is a strong support. Yeah, the roots are a deep anchor. So we often do a tree meditation and imagine the roots, right? The roots of you, which is entangled with your ancestors and your family. And, the part above the ground is really actually just a small part of who you are. And then the idea of like the branches waving in the breeze, it shows flexibility. So that's a really nice metaphor too. Sorry, do you see any more questions?
Mm, No, I don't think so. If anyone has any more questions, please feel free to type them in the chat or the Q&A.
I'm just looking at people's responses. These are lovely.
Awesome. I think those are all
Mhm.
the questions. Still feel free to type them in the chat. In the meantime, I do want to just quickly share that FCBC actually is going to have a mindfulness workshop series. So it'll be 6 virtual sessions from October 15th to November 19th from 3:30 to 4:30. It's once a week. And these workshops are to provide caregivers with an opportunity to practice mindfulness together, reduce stress, and build resilience through the guided weekly sessions. So it'll help, caregivers learn and practice these mindfulness techniques and build self-compassion, and hopefully leave with simple tools and resources to be able to use daily. So that is coming up. We are currently full. However, if you are interested, please send us an email, and we can add that. We can add your name to our wait list.
That sounds
And
amazing. Yeah.
yeah, it's the first time, so we're excited um to start that off and see how it goes.
Cool. I see one
So
more
I
question. I'll just quickly address it. In square breathing, is the pause the same amount of time? So your square breath could be a square, which would be like, you're breathing out for 4, hold for 4, in for 4, hold for 4. But often the holding that long is uncomfortable. So we make it like a rectangle, right? So you might breathe out for 4, hold for 2, in for 4, hold for 2, that kind of idea. But with it being square, the idea is that there's a similar pause at the top and the bottom, right? So when we get into the triangles, that's where we eliminate one pause or the other.
what are your thoughts on
Gabor Mate. I'm not sure what Angelita's getting at, but he he comes from a trauma-informed perspective, and he talks about addictions and mental health issues being related to childhood trauma. So I'm not sure exactly what part of his teachings she's directing to, but he does do a lot of similar self-compassion and mindfulness. Yeah, trauma. That's a whole other talk, but certainly we know that trauma is very pervasive, and many people have had these sort of difficult experiences. Well, one thing I will say is that if you have a history of trauma from earlier in your life, often when a person gets ill, it's like being re-traumatized. So it can bring up some of the issues from earlier in your life that weren't a bother before, but then when something happens in the present, sometimes they resurface, and the symptoms are worse. So yeah, again, that's a whole other workshop, but it is definitely something to think about. Yeah.
Yeah. All right. I think those are all the questions that we have. I will just share this up here. So if anyone has any questions or would like
Oh,
to put
the
their,
slides too. Yeah, I'm happy to share the slides too. Someone had a question about whether they could get access to that, so I can just send you a PDF of those if you want.
that would be great. So I will be sharing a survey with all of you. So keep an eye out for that email, and I'll include the slides as well in there.
Great. Thanks everyone for coming today.